Hey guys, I wanted to jump on and talk to you today about torticollis. I don't know if you ever heard of this word before, but it often happens in babies and young ones. And it can even start as early as in the womb, meaning that a lot of times the causes of torticollis are a shortened SEM, sternocleidomastoid muscle, which is the muscles kind of up in the neck up here, and it can cause the head and neck to go down and rotate in a position where they get stuck that way. A lot of times this happens due to birth intervention, in the sense that if there's a lot of tension or a lot of stretching on the neck right away at birth, and there's misalignment of the spine, it can affect how well the communication of those muscles work, and then those muscles can go into a form of contraction. And when that happens, they get stuck in this position. So a lot of times when medical doctors talk about this, they don't talk about the effects that a C-section can have on a baby's neck and their neurology, as well as how it can affect, things like vacuum extraction, things like a forceps delivery, things like a C-section can all affect or strain that neurological connection to that area, and it can cause the head and neck to get stuck in that downward position. And a lot of times they just say, hey, you know what, we're going to wait and see how it goes, and in 6 months from now, if they're not better, we'll work on dealing with it. And that's always not a great strategy, especially from us chiropractors, because we know a lot of times the neurology is involved with that, and there's a misalignment that's not allowing the communication to get to the muscle, which is not allowing the muscle to work the way it's supposed to and function the way it's supposed to. So when we hear doctors say, hey, go to the PT, use a heat pack, do these stretching, well, a lot of times when they do that, parents often tell us that, hey, you know what, my child was in a lot of pain when we did those stretches. Hey, you know what, the heat pack worked for a little bit, but their head went right back to the way it was. And the reason why is it's a neurological connection. So a lot of times what we do is we do scans in our office to determine if there's stress on the nervous system, especially upper cervically, that's affecting those muscles in the neck that are holding them in that contorted position and stuck that way. So the idea behind increasing the connection of the nervous system, it's going to allow the muscle to relax and adapt to its environment. And as we do that, the muscle will start to calm down, and then you'll start to see the head come back up in the right position. And a lot of times when we do our neurological scans, we use a system called the insight scans that helps determine if stress is on the nervous system and where it's located and how long it's been there. If there's a severe amount of stress, it could take a little bit longer for that torticollis to go away. But as soon as we find out the area that needs to be worked on, we work on improving the connection to those muscles. And as we do that, we can start to see the baby change. And we see it all the time in our office, guys, as far as getting that correction to happen. But if the connection isn't there, if there's nerve stress there due to trauma or due to any type of other issue that's not allowing that muscle to work the way it's supposed to, that baby's going to be stuck. And the idea behind this is, we're not discrediting PTs at all. They do a great job. The whole thing is, though, if you don't get that neuromuscular connection happening, you can stretch and stretch and stretch and nothing changes for that child. So the idea behind getting the neurology correct and getting the stress off the system is going to create a calming effect and an adapting effect for the baby. And then you start to see changes in how they hold their head and how they hold their positioning. So if you know a child who struggles with this type of issue with torticollis, or you know someone who has a child, please let them know about this video. Please have them contact our office, and we can actually get them checked to see if the neurology is affecting how the muscles work. We'll see you guys later. Have a great rest of your day. Bye.